The key takeaways are a few things. One, we've got some very interesting biomarker studies that are running at the moment. One of the most interesting was looking at a clinical classifier that allows the selection of patients who do better with intensification of treatment. And this classifier, called the Omega classifier, looks to balance the risk of the recurrence from the tumor and death from the tumor with death from other causes. And if one has a high Omega score, that means they are more likely to die from the tumor, and therefore they benefit more from intensification of treatment, which actually makes very intuitive sense, but they have managed to do that within the setting of a score that can be applied in clinical practice. And therefore that's very exciting, and we look forward to some prospective validation of the findings. There were several interesting early trials that have been reported on in the poster session, and one of the more interesting ones was Monalizumab with Cetuximab, and the combination showed a significant increase in survival and in response rates. And that is and the toxicity was not much more than Cetuximab on its own, and therefore that really is a potential for future studies to change the way that we are treating our first-line and second-line recurrent metastatic patients. So those together were really, for me, the highlights of the poster session.